Myself, Dr. Jayesh Desai, consultant nephrologist, to wish you a good kidney health on a day of World Kidney Day. Feeling of cold during dialysis is not only a comfort issue, but cold exposure can trigger physiological response like vasoconstriction and shivering, which increase the metabolic demand and may affect patient's recovery after dialysis. Not only a thermoregulatory system, but sometimes bad handling of the patient having infection on the catheter or patient having infection on the skin can also trigger a thermal irregulation. Prolonged shivering increases oxygen consumption and metabolic demand of the patient. Energy that should help for recovery of the patient has been utilized during the shivering, and hence patient will be having discomfort and fatigue after dialysis, and this thermoregulatory mechanism also cause disturbance in temperature and patient will have a feeling of discomfort, and that's why many patients says dialysis के बाद तो थकवा आ जाता है. This is because of their probability shivering, which has made them a problem of fatigue. Patient with chronic kidney disease has often have anemia, sarcopenia, chronic inflammation and protein energy wastage. Because their metabolic reserve is already low, prolonged cold stress can worsen fatigability and energy depletion, and by which they keep fatigue. Yes. See what happened during shivering and cold exposure. Patient heart rate increases, that tachycardia itself will also cause heart to work more and patient may fall repeatedly in heart failure. So what happened during this? So because of the overactivity of sympathetic nervous system, there is causing a vasoconstriction and increased cardiac workload. Repeated exposure such what may cause cumulative cardiovascular stress, cardiovascular disturbance in a dialysis patient. Polar dialysis can improve hemodynamic stability and reduces intradialytic hypotension, but it may increase the sensation of cold and shivering in some of the patients. It can be individualized. However, dialysis temperature should be individualized based on patient's tolerance, blood pressure, patient stability and comfort, rather than using a fixed temperature for all the patients. But it may be not impractical in all dialysis department to use different temperature for each of the patient. First of all, our technician should learn the proper process of sterility and using a catheter properly, which can prevent half of the patient dialysis shivering and temperature. Keeping a sterility and keeping a catheter properly will prevent a dialysis chill. However, during dialysis, there are lots of AC machining going on. Because of our dialysis machine, we have to maintain certain temperature. So you can provide blanket during dialysis, maintain appropriate room temperature, ensure proper patient clothing, avoid direct cold exposure and direct airflow towards the patient, and you can use a thermoregulated blankets or temperature controlled jacket, which can be used during the dialysis. Now what is this thermoregulatory jacket or a blanket? This has one side cooling effect and other side is a warm effect. Like a Thermaissance jacket, which can be utilized for thermoregulation along with medication and whenever required. We have to use a textile in a dialysis should be such that it can be easily cleaned, preferably antimicrobial and capable of repeated laundering to reduce infection risk in immunocompromised patients like CKD. The key message for dialysis provider is dialysis adequacy is not only about technical parameter like to maintain duty by C, but patient comfort, including thermal comfort, plays an important role in improving dialysis tolerance and recovery of the patient. So when patient comes to dialysis unit smiling, they should go smiling without any particularity. Thank you.